Hello, this is a short talk that I recently gave at the Association of University Radiologists on how to teach radiology on YouTube. So here are my objectives. I hope that by the end of this you'll be able to develop pre-existing resources into YouTube videos, optimize the content for viewers, use annotation to focus viewers' attention, and then really to leverage the power of YouTube in your radiology teaching. So why YouTube? Well, I think this is pretty obvious, but there is a worldwide audience of gazillions. So the lecture that you give to your class of 20 or 40 residents can really be extrapolated to hundreds or thousands, or if you're lucky, hundreds of thousands of learners. It has really become the go-to resource for educational content. If you want to learn how to mend a puncture on your bike tire, it will teach you how to do that. Or you want to learn how to read a chest x-ray, it can teach you how to do that. It allows you to recycle your current scholarship. So you can take what you have and then modify it slightly, as we're going to talk about. It gives you long-term free storage of your content, so you haven't got to worry about your hard disk crashing or getting filled up with these videos. And it will provide you with some metrics for promotion. Are those accepted by all institutions? No, but increasingly they are being accepted by more institutions. So I do have a YouTube channel. I have a reasonable number of videos up there. I'm certainly not viral, but at least I know enough, I think, to be able to give you some guidance. My most viewed video is this one, and I was very excited because it had 78,000 views, which is, 78,000 more than otherwise would be listening to it when I'm just teaching my students and residents. However, it turns out if I'd put a few funny cats in it, I would have got 7.2 million, so I'll remember next time. So what are some key guidelines? Everybody's attention spans are short. Mine are short, yours are short. Our learners, particularly our learners of more recent generations, are definitely short. They're going to watch most of these videos on 1.5 to 2 speed. Don't be offended by that. It just means you do need to accommodate that. I know that my talks are paced appropriately such that you can understand them at least 1.5 speed. And I'm a bit Mickey Mouse at 2, but good people can do it. So that means that clarity is all. More is definitely not better. Keep them short. Perfect is the enemy of good. Unquestionably here. We can spend a lot of time trying to make our videos perfect. And I'm definitely my own worst enemy. I definitely try to, take out any flubs and the ums and the ers, and they drive me mad. And I probably spend way too much time compared to what I see out there on YouTube. I do think, however, there is a bit of a spectrum here. You can go for the super quick and casual type talks. You certainly see many millions of those on YouTube. You can go for very highly edited professional talks, such as maybe put out by a CME company. And there is a sweet spot in the middle of this, the sort of thing that we can do with not too much work, but again, looks professional. So if you haven't got a YouTube channel, you need to obviously start a YouTube channel. That will take you like 10 minutes. Take a current lecture of yours, that's probably 45 minutes or an hour, and split it up into 10 to 15 minutes chunk according to content. And a good way to split this is often by the learning objectives. So you take one primary learning objective, you take the content that applies to that learning objective, and you put that together into a video. You could even make them shorter than that depending on the sort of lecture you have. You're going to edit and format your slides for clarity. We'll talk about that more in a minute. You want to limit the text on your slides. If you haven't seen my brain-friendly teaching lecture, which, funny enough, is on YouTube, but it is an hour, so I haven't kind of paid much attention to what I've done or I've learned along with time, I suggest you look at that. And then record one short talk. This is radiology, so we want to include lots of images. You do not want to put large tables or complex charts in. If you have table or chart data, pull out the important stuff for it and put that in. Again, go back and look at my brain-friendly teaching talk. Leverage humor in this. It's really important. It's really boring looking at long, boring videos. Drawing or annotating on your images, and we'll talk about it a little bit more in a minute, engages the attention of your learners. And here's just a short example of how I use annotation in a lot of my teaching videos, in this case talking about CT windows and levels, to really focus the attention of the learner.
Each of these different windows aims to maximize the display of one particular set of soft tissues, but at the cost of us not seeing the others. For example, here we are looking at soft tissues of the mediastinum, but we cannot see the lung. We can see the lung on the lung window, but we can't see the mediastinum. And we can see the bones here, but we really don't see the soft tissues or the lung very well.
There are some decisions you need to make when you're recording your videos. One is, are you just going to have your voice like I'm using here, or do you want your face being displayed on the video? You can use the camera on your computer, on your iPad to add your face to it. I personally don't like having my face displaying. I think it's very distracting. I also like to sort of walk around and wave my arms quite a bit when I'm lecturing, even when I'm recording. And I don't find it really adds anything to the video. Sometimes, I'll put my face and just a sort of quick hello at the beginning so people sort of have a face to go with the talk, but I don't keep it going all the way through. You have to decide on your recording methodology, which we'll talk about, and then whether you're going to use annotation or not, like I just showed you. Okay, so let's talk about recording softwares. What type of recording software you use will depend on obviously what you have. You probably actually have several, whether you know it or not. And there's certainly a large number that are available for a reasonable price, but also how long the video is going to be. If I'm making a super short video, I'm probably going to use something like Snagit. I'm just going to record it in one big go. It's super easy. Also, whether you want it to be editable or not. If you want to be able to edit it slide by slide, that's going to limit you to the sort of softwares you use. How many flubs are you comfortable with? Are you willing to just sort of let them go? Are you going to be really bothered by an and an R and a little flub and going to want to re-record that whole section? Do you want to be able to edit it on a slide-by-slide manner? Do you want to annotate it? And then obviously what interface you have. Do you have a PC? Do you have a Mac? Do you have a tablet? Because there's recording software available for all of these. So there are several options for recording software, and your decisions not only going to depend on what you have available, because you probably have several types available, whether you know it or not, but whether you want to do a very short video or a longer video. If I'm making a super short video, I might use something, whoops, can't remember what the hell it's called. Both PowerPoint and Keynote now have recording software within them. It's a little bit clumsy, but it's not too bad, and you can re-record on a slide-by-slide basis. It doesn't allow you to do the degree of editing that you certainly can within other softwares. You can record your talks in WebEx or Zoom, so you just sort of set up a session, you click record. Now that's going to be sort of one big recording. You usually have very limited editing ability. You can usually sort of trim the beginning and the end, and might be able to take a big chunk out of the middle, but you certainly can't edit it on a slide-by-slide basis. So if you're going to use that, it's very easy, but you certainly do have to be comfortable with having the sort of number of flubs that we do have when we're giving a longer talk. You can do screen recording software. I use Snagit a lot. If you haven't come across Snagit, it's super cheap software for all types of different screen captures, video captures, image annotation. I probably use Snagit 3 times a day, every single day, whether for home or for work. QuickTime also allows you to do this. If you want to spend some bigger bucks and you really want to have a lot of control and produce more professional looking products, then Camtasia. And then I'm recording this on Explain Everything, which is software which is available for both tablets and for PCs and Macs. I use it in tablet because I like to be able to do the easy annotation with my finger with that. Has a lot of great things. You can stick videos in the middle of it, like I just did with that annotation video. You can edit down to sort of the individual words in a very, very easy way. So I would recommend that, and it's very cheap. I do recommend that you get a decent headset. It's going to really reduce the amount of background noise when your husband comes in and runs the espresso machine, or your dog's bark, or your cat meows. You're going to have much less of that type of interference if you use a headset. I like to have a Bluetooth headset because I like to be able to walk around. Make sure your environment is quiet. If anyone can hear funny noises on this, it's because I actually have bald eagles above my house in a nest, and they're being extremely noisy because they're teaching the babies to fly at the moment. So you may hear that coming through. But, you know, this is not a professional video. What can I say? If you're recording your face, you need to have front lighting. Check that video. Make sure that it's not looking right up your nose. I actually think it really helps to stand up to record. So, you know, I'll put my iPad on the kitchen counter, or I've got it elevated on some books here, and I like to be able to stand up. I'm using hand gestures. That really helps keep your voice active and not sort of do this sort of monotonal reading off your slides. If you want to do annotation, I'm not doing much in this, but I do an awful lot when I've got images up. You can do it in a variety of different ways. You can use a trackpad or a mouse on your computer. There are various little software things, like there's a little app called ScreenBrush for Mac, which means that you can call up annotation software, whatever program you're in, and just draw on top. You can use the annotation tools within PowerPoint or Keynote. They're a little bit clumsy, but they work. Or if you have a tablet, to my mind, that makes it much easier. And that's what I use when I'm using Explain Everything. Whatever method you choose, be prepared for things to take longer than you think that they're going to take. When you first start, a 10-minute recording is probably going to take you an hour, and an hour recording is probably going to take you 2 or 3 hours to get done. But really don't aim for perfection. You know, your listeners really don't care as much as you think they're going to care. If you have a lot of background noise, that might start to get irritating. And you can do, as I said before, in many softwares, a little post-recording editing just to tidy stuff up. And once you've done it, you just upload that to YouTube. Some of the recording software allows you a direct link to YouTube, or you save it as a video file on your computer or on your iPad and then upload it direct from YouTube. You want to set the parameters, such as whether you want it public or private. I make everything public because you just need to be not afraid of comments. I used to be afraid of comments, but I'm not afraid of comments anymore. And then publish it. So how do you get it seen? Well, I'm hopeless at this, to be honest. Clickbait titles. I like this, BPE, which is background parenchyma enhancement. BPE or not BPE, that is a question. Nobody else got this joke apart from me, so it didn't really help in the slightest. But, you know, you've seen the clickbait titles out there. You can come up with one much better than me. I do suggest trying to select an engaging image as the thumbnail, add keywords for people to be able to search for it. And then how do you use YouTube in your teaching? Well, it's a great addition to the flipped classroom model for either students or residents. So this can be the homework for your residents. I have a YouTube video on the flipped classroom model, amazingly enough. But, you know, you want to have a video that's no more than 20 or 30 minutes, which they will reduce to 15 to 20 minutes by speeding it up some. And that makes a good homework thing that you can then have the more active teaching in the classroom the next day. Very short videos are excellent. So like 5-minute videos or 3-minute videos, you'd be amazed how much you can teach in 3 minutes, are excellent for workstation teaching. And I use them a lot in breast imaging. I have a number of short videos when I've explained the same concept that really requires some kind of a graphical demonstration multiple times. I now have it on an easy link from the desktop. They can just go in, find it, go through it while I'm doing something else. If your learners are absent for some reason, they're going to miss lectures. And then for procedural training, we have a large number of videos for procedural training in breast imaging at my institution. And when residents rotate for the first time or they rotate back to that rotation, I get them to look at those to refresh themselves before I let them loose on patients. So in summary, using YouTube to teach is so much easier than you think it's going to be. It really does maximize your audience, and it really reduces redundancy of having to teach the same things again and again and again. You can just send them to the video. And don't be scared of comments. Most of them are really nice, and you don't have to read them if you don't like them. So in the end, just do it. And thank you for listening again.